important to state that a lot of the common factors that affect occupational health and safety, those common hazards and risks for operators, exist. And then when you take them into a harsh and extreme environment, quite remote from accessing definitive care, you're in a position where those effects are multiplied. Some examples are obviously the harsh environment, the extreme cold, hypothermia. Some less obvious things that people might not consider are areas of risk with regard to psychological well-being. So resilience, that people aren't necessarily prepared for a harsh environment, for the long hours, the stress of operating in complete daylight for periods of months or complete darkness for periods of months. Those are some of the less obvious areas where people might attend to in terms of a focus that's specialist for Arctic operations. Finally, I believe there's a great importance to develop standard operating procedures within the industry for operating in harsh and extreme remote locations. And the reason for this is if you look at the accident rate for accidents that have a human cause behind them, an absence of a standard operating procedure or an insufficient standard operating procedure is found to be causative or at least contributory in about 80% of those accidents. One of the really important things is to focus on a proper risk assessment. Proper risk assessment is the foundation for any occupational health and safety management system. And it's no different when you're going to the Arctic, to other regions. If you don't conduct a proper risk assessment, you really have no ability to put in place proper controls and mitigate those risks and hazards faced by the employees when they're headed up to extreme remote locations. So part of that entails making sure that the risk assessment is done as early as possible. What we find often is that the risk assessment is done as part of the departure procedure, and it should be an upfront measure. I think additional measures could be investment in leadership activity where people are determined to put in place a culture around health and safety for the organisation, and they sign up to that proactively. A further area would be around resourcing education and awareness and training for specific groups who might be headed up to a harsh environment. So those would be some common areas. I think one area that's often not attended to as well as it might be is the issue of pre-employment medical screening or pre-assignment when you're going into an extreme remote location medical screening. It's really important that we don't carry our personal health risks into an environment where safety of ourselves and others might be put at risk. And conducting a proper pre-employment medical screening or pre-deployment medical screening, including psychological evaluation for depression, stress, anxiety as part of that, and even going so far as to have a dental inspection would avoid a lot of the accidents and medivacs that occur in extreme remote environments.